Hello to our Children's Workshop community. We're here today with Mary Cody, our Regional Director of Nursing Services, to ask her some questions pertaining to the COVID-19 health pandemic and how it's affected childcare. Mary joined our team in 2004 and is available to support children, families, and staff with questions related to illness, infection, and other health and safety concerns. So Mary, if you're ready, let's begin with our first question.
I am ready.
Right. Thanks for being here today.
No worries. I'm glad to be here.
What has the Children's Workshop done to enhance their health and safety protocols since the appearance of COVID-19?
We had to look at our facility's entire operations and consider, first of all, access to supplies, review and update our health and safety policies and procedures. We do follow strict guidance from the American Academy of Pediatrics, Caring for Our Children, and other resources that provide the best health and safety standards. We also, from head to toe, changed everything to accommodate the mitigation practices of COVID. We staggered our family drop-off times, or we had a staff person go out and pick children up outdoors, so we limited people that were in the facility. Staff are required to wear appropriate face coverings at all times while in the facility. Not just wear them, but wear them appropriately. We maintain social distancing as much as we can working in an early learning facility. Our classrooms are organized into pods, so it's the same children each day. So it's consistently the same group, so to minimize interactions between children. We set up isolation areas or rooms, so if a child does show any symptoms of illness or a staff person, we can isolate them right away and receive guidance from the Department of Health on next steps. We try to spend as much time outdoors as we can, but when we can't, we follow the good practice of opening windows, ventilating, moving throughout the building in a staggered way so we're not running into other classrooms. Maintaining social distancing during napping by putting kids head to toe. There's lots of little tricks that we've been working into our program.
Great. All right. Can you give us some professional feedback on why getting the vaccination is so important?
Sure. Wearing masks, social distancing, and the other mitigation steps that we've been taking for the past year are not enough to impact this pandemic. COVID-19 vaccination helps to protect by creating antibodies. Your own immune system helps to build protection against the COVID-19 virus. The studies are showing that by getting the COVID-19 vaccine, whether it's Moderna or Pfizer, with the new variants that we have that have entered the United States, the UK variant, the South African variant, it's showing that the vaccine that we're receiving now will have efficacy towards those strains or those variants in the future. So there's a lot of benefits towards getting as many people vaccinated as fast as we can do that to help mitigate this pandemic.
And what are your hopes for the future of childcare?
Honestly, my hopes for the future of childcare is now that this pandemic has happened, it's brought to light how important early learning and education is. I feel that our educators that are teaching young children are educators first and foremost, and it really doesn't matter the age group of who we're educating or caring for. There's so much debate about returning to schools for K through 12, and we've been here since June. Our positivity rates are extremely low. We have a relationship with the Rhode Island Department of Health and the Department of Human Services, as well as the CDC, that I'm hoping never changes. I feel that our teachers are teachers and should be protected like all teachers and all educators for the youngest people that we serve. And early education is so important to these kids, the social, emotional, what they will suffer if they're not in early education and care, just falling behind in socialization and depression and there's so many factors that these kids need to be socialized and back into care.